This conference will now be recorded.
Hello and welcome all of you for Rayz Mrcog Part 2 Orientation. And I'm Dr. Rashmi Patil. I'm the Director and Chief Mentor for the Rayz Academy. And today we are going to discuss about the Part 2 exam. What are the approaches? What are the types of questions that you'll be getting? What will be the materials and the books that we need to go through for the Part 2 exam? So we all know that success, it doesn't come easily to us. We have to go towards it and we have to work hard towards that. At the same time, work smartly also, because in a short time time frame, how much we'll be able to be productive in our approach to the exam, that is very much important. The format of part 2 is similar to part 1. As all of you know, you have the Pearson View centers, and similarly for the part 1 exam, in the same way it is for the part 2 exam as well. So 3 hours of exam with a break in between, and it does contain something called as an extended matching questions. So this is something different compared to your single best answers which you have given in your part 1 MRCOG exam. So I'll be telling them in detail about what is an extended matching question also. And this is extremely important because though there are 50 questions from SPA, 50 questions for EMQ in one paper each, but still the marks that they carry, they are different. These two, all the computer based test part 1 and part 2 exams, so these papers will have two sets, and it has single best answers worth 40% of the total mark, whereas extended matching questions would be worth of a 60% of the total marks as such. And the duration, if we see, the time duration that is provided would be similar. Again, it is 3 hours, that is 180 minutes. Now in this, the number of questions that you are going to attempt, because single best answers, we all know that it is less time consuming, whereas extended matching questions would require a little more approach. Single best answers, you all are well versed, so you get options and you have to click on the single best answer and submit that. So one answer would be available, whereas in an extended matching question, you will get multiple options. It could be 8, it could be 10, it could be 15 also. So these are all the various options which could match with your question. For example, if they take one question on deep vein thrombosis, VTE, that is venous thromboembolism, there are guidelines based on that, and that topic is taken. You may get 3 questions on this particular venous thromboembolism, and each question would have one answer which is very much there are options which are very closely related, but one answer is the correct one. So you have to eliminate the options and choose that one answer for that particular question. So you have got certain topics, certain guidelines based on which you will get set of questions like this. You can get a set on questions on the contraception, you can get a set of questions on the reduced fetal movements. So there are a lot of guidelines and individual guidelines, some set of 2, 3 or sometimes 4 questions they can pick up, and then you have 8 options, 10 options, 15 options, out of which you have to make sure for this particular question which one suits the best, and then choose that answer. So this is called as an extended matching question. Now there are a lot of time that would be required to go through all the options, so we'll be dealing with all the smart approach about how to rule out the other options and approach to either 2 or 3 options which you have cut short, and then choose the best among them. So that will be taught again how to approach for the extended matching questions. Now single best answers, they are 50 in number, and again you have 50 extended matching questions in paper 1, and duration would be 80 minutes, 180 minutes. Now what RCOG would recommend is you spend a little less time on a single best answers, probably like 70 minutes, and then 110 minutes on the extended matching questions, because that is the important one. You have to go through all the options there. It would take a bit of more of your reading time and analyzing things also, and then you have to pick up that particular option for yourself. And similarly for the paper 2 as well. Now the dates that they have announced is Wednesday, it is January 22nd to 2025, and expression of interest would close by Friday 20th September. So all of you please mark these dates in your calendar. Expression of interest is something like you have to go through the RCOG website, log in into your account, open the MRCOG Part 2 exam. There you have to show the interest. So expression of interest, you have to fill that form. It hardly takes few seconds. Just have to fill that form and submit. This shows RCOG that you are interested to give Part 2 exam, and they will send you the mail through which you get the booking token and you will be able to book your exam. So booking window would open on 29th of October and it would close out on 17 December, but I would suggest all of you please book on 29th October itself. Maybe you will not get the center of your choice otherwise. So it is good idea always to book the center on the same day itself that the booking window opens, and results again it would be released after a month. And the part 2 fees, it depends on the band, that is UK, Republic of Ireland. They have 534 sterling pounds, and most of the Indian centers, all these, the students, they come under this band B. So you have to check the band and then submit your fees. About the study materials and the preparation, there are a lot of books and you get a lot of single best answers, extended matching questions, which are extremely important. But what I would say is some of the books are outdated. You have to always read the new guidelines. And all the questions that are framed, they will be from the new guidelines. So they keep on analyzing, updating the guidelines then and now. So recently, all the management of nausea, vomiting, and pregnancy that has been updated. Then you have the small for gestation age babies. So that guideline has been updated. So a lot of new guidelines keep coming up. So I'll be posting all those guidelines and similar things, the materials they are present on the website as well. So all these guidelines have been compiled. It is always good idea to go through the guideline first and read and grasp all those things. And then you're supposed to simultaneously solve the questions also. But at the same time, the one books which are updated, so they'll be having the references of the newer guidelines. But in case the reference is an old one, means that particular book is not updated and that guideline thing is not updated. But I would always say the questions are important, though the answers would change. So we'll be discussing all those things also, that which would be the best answer for this particular question in this particular book. So it is important to know that the guidelines get updated, and similarly the answers would also be updated by you in your book. If the older versions are there but they do have some good questions, so always recommended to have those practice books. So all of them are available as PDF formats, and keep solving them also. But at the same time, you should always back up your answer with the fresh guidelines. Now, as yeah, just a minute. So, as I would always say, there is hard work and there is smart work. There is no replacement for a hard work. You have to put your 200% in this, because a lot of things do matter. Maybe like few things that you have studied, it may come, few may not, but at least somewhere you would have read a couple of months ago. But it is always important that your basics and the concept should be really strong. Only then any question that would pop up in your exam you'll be able to answer. RCOG keeps on updating their question bank. So you have to make sure that yes, recalls are important, but the questions may get twisted. It is not always like, okay, this is the scenario that it is showing up, and yes, I know this was the answer last time we had discussed. No, it won't be like that. You should make sure you read and analyze the question and then you pick up the answer, because they keep on updating all the recalls. It is good idea to practice the recalls, yes. At the same time, you should know that guidelines are important, the concepts are important, that clarity should be there in your mind. Only then you will be able to answer any question that they put up. They may twist, they may add on an extra information, they may remove an extra information that was there in the previous question, they may keep adding options differently. So you should know which one to choose better. So hard work and smart work is extremely important. So whenever you're giving one reading about the guideline, you should understand and the concepts, everything should be clear in the first reading itself, and mark all the important points that you feel. And when we are taking the class also, that time I'll be highlighting all those important points which have kept on appearing in exam, which RCOG feels this is extremely important for you to know to pass MRCOG Part 2. So this smart work itself is important. At the same time, do not spend 6-7 hours reading one single guideline. I would say somewhere all these guidelines, 30 minutes to 1 hour is sufficient enough to have a good read. And then you should just take a highlighter, or if you're one person who is reading through the PDF, just highlight the points then and there itself. So your notes should start getting prepared from day one itself. You should underline them. Either you take a printout and mark if you are a person who does that. Otherwise, if you want to read through the PDFs, you can also highlight it then and there itself. So these things, try to use different colors and mark it. So these things are very much important, and you should know that how to delegate all the things, the work as well as your guidelines, because Part 2 exam is completely different from your Part 1. Part 2 is extremely dependent on the guideline based questions. So if this is there, means you have to answer that. Any even dosages change of that, it doesn't accept. So you have to be very clear in your thoughts. And definitely the tendency would be there to forget things. But what would help us is revision. So keep revising things. Once you read a guideline, go to the next one. Again, quickly revise the previous one. Spend some at least some 10-15 minutes to revise the previous work that you have done. Then again at the end of the like 5-6 days or a week, again try to recollect all the guidelines that you have read in the week and go to the next one. So it should be kind of a repetitive procedure which helps you to create a long-term memory. So it is important that we keep stimulating our brain cells so that this information gets stored in the long-term memory. So make sure that whatever time is there with you, you have to be efficient, you have to be effective. At the same time, that hard work is extremely important as well. So try to do most of the things in your first reading itself, but do not spend more than an hour for any guideline. Now there are green top guidelines, there are nice guidelines, there are talk articles. So green top guidelines, you will be getting all of them in the RCOG website, and even the nice guidelines, all of them are freely available in the nice website. The talk articles are something like a journal. Every year they have 4 volumes that are getting released. The issues which come up again, so issue 1, issue 2, issue 3, issue 4 you get, and a volume is released like that. January, April, July, and then October. So these are the journals that they release. In that, you'll be having some 8 to 10 articles. So these are important. Most of the time, they would ask the previous 3 to 5 years dog articles, and they keep updating them as well. And the one which are previous one, you may not have to depend on all the values as such. And dog articles, there are certain topics which are exclusively covered in TOG. They may not be available in your Green Top guidelines or your NICE guidelines. So such articles you have to depend on the TOG itself. So the older ones, but always remember your Green Top guidelines have the highest value in this exam. They are the RCOG produced guidelines. They have the highest value. And then comes the NICE guidelines and the TOG articles. So NICE guidelines, though they are like couple of pages and all, but every line is important in that you will realize as and when you read, when you understand that this guideline, everything that they have written, it is important from your exam point of view. So nice guidelines is itself like a summary, I would say. Try to read all the information that is given in the nice guideline. Green top guideline, yes, it does have a lot of studies quoted, lot of percentage quoted, but there are certain key recommendations that you are supposed to know. There are table formats that you are supposed to know. There are algorithms which will help you in your extended matching question. So if this is one case, this is the next scenario, what you're supposed to do. So you just have to follow that algorithm. And most of your extended matching questions which are coming up, it's all the algorithms would give rise to all the EMQs, I would say. And similarly, single best answers, a lot of important points, the key recommendations that are there in the green top guidelines, the one which are in the bold letters, and in between also you get few percentages which are very much important for your exam. So we'll be highlighting on those percentages as well. But do not try to remember a lot of percentages. I would say you'd get confused. You have to write down in the notes and just highlight few percentages like this which are important for your exam point of view. But every now and then the odds ratio keeps getting quoted. There are percentages that are being compared, but not all of them would be important. So always give priority for a green top guideline, the nice guideline, the TOG articles. And then you have the sexual reproductive health, the contraceptive guidelines which are released by the FSRH, and you have the BASH guidelines to cover the infections, and the FIGO journals which will release about the cancers, that is important. And the NHS has a cervical screening pathway which they have updated, and they have highlighted upon the importance of high risk HPV detection and then offering the smear or the colposcopy accordingly. So this is a must, because it definitely comes in your exam either as a single best answer or extended matching question. So the pathways, once you repeatedly revise them, they become very easy. So I'll be teaching you how to read through these pathways as well. Then there are consent advisors, then scientific impact papers are there, ESHRE guidelines, the embrace articles. These are also important, but yes, as I said before, the green top, nice, and the talk articles, they are important. Then we have something called as the clinical governance. So NHS does follow a certain systematic approach for how they work. They have certain tools to analyze their work, and they have certain principles which they follow. It could be like how you deal with your patient, how you deal with your colleague, and what documentation, the legal things that are important in NHS, and how you raise an incident report if something has gone wrong, what is the risk management team and how they manage things, what are the teaching pathways that they follow, what is the order that they have, the methods of teaching. All these are important, and they do come for your MRCOG Part 2 exam. There are a lot of other important topics also we'll be highlighting upon regarding the NHS, and as and when the questions are getting solved, we would have highlight that as well. Now the Strat OG, previously it was they had a set of questions. Now the website has been updated, and they do have certain articles written over there, but the previous one which were there, they were extremely important, so we'll be highlighting and including them in your live sessions and the other preparations also in the Telegram group. So these are also important one. Now speaking about the books for your exam, you will get ample of single best answers and extended matching questions book. The important ones, again, Andrew Sizer, this is the updated version that they have released, and you have single best answers by the Brian McGovern. So but this is a older one, and Amanda Jones also is an older one, but it's an RCOG book. Though it is not updated, we would suggest that go through the questions again. The get through books have been updated. One is for a single best answer and the MCQs, and you will get other lot of questions also. The Justin Conjay, the new book that has been released, and you have mastering single best answers, that is also important. You have the Chinmay Rathi and the Janish Gupta's book, and succeeding is also important by the Sharmista Goa. And these questions, I would say, again, back up with the guidelines, cross check with the questions answers. If any doubt is there, we are also there to solve and help you with this. Similarly, you get a lot of extended matching questions. All these PDFs, everything, they are available in the file sections in the course group also. And single best answers, EMQs, there are compilation, and few books are exclusively for EMQs, and they will help you how to cut short and then choose the answer that is available. And similarly, you have Kalaivani also, you have 500 SPAs, and you have the single best answers MRCOG part 2. Extensively it is also covered in the website. All the guidelines will be compiled in one folder, and they are the original guidelines. In the other section, you would be getting the summary of the guidelines. So if anybody wants just to go through the guidelines first, they can read that. Or similarly, you can download all the guidelines and then go through that materials also by yourself. If you want to read from the website, you can read all the guidelines which are given in the website also. And similarly, the summaries would be updated regarding those guidelines. You can have a quick revision of the summaries as well. There are few recordings which are the audiovisual summaries which will help you to analyze, especially the small topics which would otherwise be like talk articles or something. So they have been converted to the audiovisual summaries. There are mixed pool of all the recall questions, and I would suggest that start solving them at least like a month of practice that you have with your guidelines. Then you can start solving these recall questions also. So you'll understand about how the questions have been asked in the exam. But the initial month would be on highlighting on the preparation and how you are supposed to approach to the part 2 exam. There are green top guidelines and nice questions that are being arranged, and you can solve them once you read a particular guideline, go through the summary. You can also take up the question pool. Talk articles, yes, the questions have been arranged year wise again, article wise again. All the articles, the journal articles are also being uploaded. So you can just go through the guideline, open the question pool, and solve that again. And a mock exam would be provided towards the end of your the preparation there. And telegram group would be there for discussion of the recalls again. So it is very important that you have to start putting up your schedule. Weekly topics would be shared, like what all things you need to cover in one particular week which are important for the upcoming live session, and the questions will be solved accordingly based on those important topics. And telegram support would be there for any discussion or any doubt that you people have, that can be discussed over there. Now, second revision, I would suggest that once you have done with all this and the live sessions, at least you have to keep yourself 1 to 1.5 month, and there you have to do the targeted revision, which is all the recall based. So as and when you are solving the books, whichever guideline it is indicating to, please highlight it in your guideline again, because this was asked in a book. And similarly, when you're getting a recall, you can just write R or something, so that would highlight that this was has been asked previously in your exam. So make your own mnemonics and make your own colors or something which would tell you that this is from this particular book, this is from this particular recall that is being asked. So that will help you in your targeted revision whenever you're going through those articles again. So you'll understand that, okay, these all things have been asked in the exam previously, or these all things are asked in the book, and I need to know them correctly. So your second revision is going to be the targeted one, where you are revising all these key points. And towards the exam, again, we do conduct something called as a marathon course. So that is a 10 days quick revision where just the guidelines, the algorithm, the important points are going to be discussed. So it's a kind of a marathon revision that would happen, and that would be close to your exam, and it would help you to refresh and recall all the important points that are being there for the MRCOG part 2. So now the wait is over. So I request all of you to let's start the journey for part 2 MRCOG. I know that all of you people who have cleared part 1 exam and thinking to give a part 2 exam in the Jan, yes, you can get enrolled for this course. And the people who are waiting for the results to come, yes, after few more days you'll be getting your results. So once the result is available, you can log in into the website and purchase the MRCG Part 2 course. So the earlier we start the beginning, the better would be the preparation, I would say. And we would start the live session by the mid of August, and then we would be covering on the weekly basis the modules. There are a lot of modules that are there: early pregnancy, there are maternal medicine, antenatal care, surgical aspects, the core surgical skills, and you'll be having gynecological modules, oncology modules, teaching, clinical governance, cervical screen programs. So there are different spectrum of all the modules you'll be getting. So it is important to cover each module one by one, and I do have all these module wise compilation. So as and when the live sessions would be there, all the modules would get activated in your course website as well. So you just have to go through all those modules and get prepared for the upcoming live session next. So you have to keep revising yourself, and at the same time, whatever you have studied previously, you have to recall few things about that and have a quick read also. So this would help together for you for your preparation for the part 2 exam. And amongst the three parts, I would say that 2 is extremely important. This is the exam that people would face challenges, because you may be very well with the knowledge and all. If you do not have that kind of a thinking to approach for an extended matching question, then you may not attain that particular marks. But it is important because we'll all help together with this, and the analysis of the question, approach to the particular option also, that will be discussed. So in that way you would be able to solve the extended matching question. It is important that amongst all the papers and the subdivisions like your SP, AMQ, SP, EMQs, it is important for you to reach that expected standard. In case in that paper, in that particular section, if you're not reaching the expected standard, because it's a percentile, they compare with all the students and then they take out an average above which you will be considered as a pass for that particular exam. So they would take and consider the difficulty of the exam as well. If it is difficult for you, yes, it would be difficult for everyone also. If you have read few guidelines which others have not read, and the guidelines which you read have come in your exam, then yes, there the luck would also matter. But in the same way, whatever hard work you have done, whatever smart work that you're going to do from now onwards, both together, it's going to get you all success. So let's start the journey. Keep watching the Telegram groups for all the updates as well. So I'll be putting up regarding the course details as so also, and the RCOG website, which the exam related dates whatever they have put up, that also I'll be sharing for your future reference. And yes, people who have already registered will be starting the classes in the mid of August. And for the people who are waiting for the results, yes, it's few more days and then we'll be starting with all the live sessions as such. So the batches would be formed, a Telegram group is created for all the people who will be registered, and then we'll be continuing with all the discussions. We'll start with the practice book, so we'll be also solving the exam based questions also. So all the best for all of you, and take good care of yourself. See you all. Thank you so much for logging in.
Thank you, ma'am.
Thank you. Take
Thank you,
care.
ma'am.
Thank you.